Hi everybody, this is Jonathan from Paramic Financial Services.
And this is Tom.
Hey Tom, nice for you to join me today.
Yes.
This is our first time doing live stream together, right?
Yeah, that's right.
Awesome. So welcome everybody to the Paramic Hour. This is our weekly show on all things about finance with Paramic Financial Services. We hope to bring you guys a lot of good information and knowledge around your personal finances. And right now, we're in healthcare season. It's the end of the year. We're in the last quarter of 2021. Man, time has flown by so fast. And, we just feel like, there's always things to do, always things to talk about, whether it's in your personal life or it has to do with money. And I think this year is a pretty, big year for a lot of people, a lot of changes, things happening in both people's work environment, but also their finances as well. So I hope that all the information that we've been bringing to you guys is a lot of good information for you. Please help us by following our page on the Facebook page. If you guys like and follow us, that really helps us a lot. Also, if you guys go to our YouTube channel and like and follow our YouTube channel, then we can bring to you guys more content that way. We just want to share more content, more information to everybody, and that really helps us. So we really appreciate your support, and please continue to do so or share this with people that you know and care about. But Tom, you've been doing this. How many live streams have you done so far?
I mean, like 3 or 4 live streams so far.
Okay, 3 or 4. How do you like it so far?
I'm getting used to it now.
Getting used to it? Very
Yeah.
nice. So Tom is one of our new team members. And he's been with us for a couple months now. But I figure, the easiest way to get people to learn is just to put them out there so you can learn it, right, Tom?
Yeah.
Yeah, so don't be scared, right? So through this process, Tom has learned a lot. So you guys, if you guys can support him, send him some, hearts and some likes. That way, Tom has more motivation, more confidence to be doing more live stream with you guys. But today, Tom's going to be my co-host. And he's going to help, ask some questions around our topic today. Our topic today is going to be about Medicare. The big insurance, government insurance and health insurance when you retire is a huge part of planning, right? A lot of times we talk about finance, we talk about like money, right? Yes. It's always talking about money, but to get your wealth, you have to have your health as well, right?
Yes.
And so planning for your finances around not just your money, but also for your health care is extremely important. And so that's why we're going to do this live stream today is we're going to talk about Medicare because Medicare is a very important part of retirement planning. And sometimes there's a lot of myths and a lot of misinformation about Medicare. And so we want to make sure that we just get the right information to you guys. We're not going to talk about any particular companies or plans. We're just going to talk about in general so that you guys have the general education around how the Medicare works. Okay? But before we start I do news today, right? I do announcements and news today, or do you have some news that you want to share with people?
Yeah, I'm going to do the news today.
You're going to do the news today?
Yes.
Okay, so before Tom does the news today, I just want to give everybody some reminders. Okay, the first reminder is that open enrollment for Medicare has already started. It goes from starting October 15th and it goes to December. Another reminder for everybody, and because Frank is not here today, he's out on a meeting right now. But Frank loves healthcare, and healthcare season for open enrollment starts in November. So if you want to apply through a marketplace plan or individual plan, please let us know. Call the number and our phone number below, or shoot us a message on Facebook, and we'd be happy to help you guys look at plans for 2022. If you have a company plan, we will help you guys review those plans complimentary as well. So if you're not sure about your employee benefits package that you're receiving at your company that you're working for right now, it looks confusing or you don't know if you should choose this plan or that plan, give us a call or shoot us a message and we'll happily be able to give you complimentary advice on looking at your company plan, okay? The number 3 is that near the end of the year now, we're going to be coming up on tax season in January. So now is starting a good time to start collecting all of your tax papers together. If you're self-employed, start putting together all your expenses. Talk to your CPA or talk to your tax person to prepare in advance what you need to do now before the year ends. Because once the year ends, you can't go back and change things anymore, right? So make sure any strategies that you need to do for end year strategies for taxes, make sure you take care of those right away. So then that way you're not waiting to the last minute to do things. Finally, in regards to tax, those of you who have children, you should be receiving direct deposit for your children under 18. Direct deposit into your account for the child tax credit. Okay. If you haven't received that, then make sure you go to irs.gov and then you can register your family so that you can receive the proper credits. Otherwise, by the end of the year, when you file your tax, then you'll be able to claim back those things, right? So I think that's it for me. Oh yeah, on our page here, you can see Mr. Cameraman, but he is sharing with you the IRS website. It's very easy, irs.gov, and you can go in there and you can view the link, okay? So that's it for me on news, but let's get right into Medicare, right? So before we get started, we want to share some statistics about Medicare in the US right now. So Tom, can you share with us how many people are in Medicare at this time?
Okay, thank you, John. In 2020, 62.6 million people were enrolled in Medicare program, which equates to 18.4% of all people in the United States. Around 54 million of them were beneficiaries for reasons of age, while the rest were beneficiaries due to various disabilities. The U.S. states with the highest percentage of Medicare beneficiaries among their populations were Maine and West Virginia, where 24 or more % of the population was enrolled. With over 6.2 million, California was the state with the highest number of Medicare beneficiaries. And as of 2021, 63.3 million Americans enrolled in Medicare, according to CMS.
That's a lot of people, Tom.
Yes.
63 million people in 2021 are estimated to be on Medicare. And it seems like the majority of people it sounds like 65 and up are in Medicare. But then we got some people that are on disability that's on Medicare too, right?
Yes.
Yeah, so lots of people on Medicare. It seems like California, my old hometown, seems to be like the most people on. I guess everybody likes to be in California where the weather's nice, right?
Yes, that's right.
You're from California too, right, Tom?
Yes, I lived there for a few years.
Few years?
Yes.
What part of California were you living in?
I live in Sacramento. I live up north.
Okay. Anywhere else besides Sacramento?
No, only Sacramento, yeah.
Okay. Was that the first place that you were at before you moved to Texas? Or did you live somewhere else in the U.S. before?
I lived in New Jersey for a few months and then moved to California.
Got it. How do you think about that cost of living in California?
It's expensive.
Yeah, it is.
Yes.
I imagine how much did you say? 6 million people in California?
Yes,
6 million seniors in California are receiving Medicaid, which is the most out of like 10% of people on Medicare are living in California. But those people must make good money or either that their children probably make a lot of good money to take care of them, right?
Yeah.
But that's quite a lot of people on Medicare in California. It's very expensive. I'm from California myself too. I was born in San Diego and I lived in San Jose for a little while for high school. And then after high school, I moved back down to Southern California. And then I met my wife and I moved to Texas too. But I like Texas. It's very low cost living here and life is not bad. So I think this is for sure is where we're gonna settle our flag, right? How about you? You thinking about you want to move anywhere else, but or Texas gonna be the place?
I don't know yet, but for now I would just stay in Texas for a while.
Okay.
Yes.
Well, we're glad to have you in Texas, part of the team. So let's see here. Can you tell to me the percentage of the U.S. population that is 65 years and up right now?
Yes, and in 2019, about 16.5% of American population was 65 years old or over, and a figure which is expected to reach 22% by 2050. This is a significant increase from 1950, when only 8% of the population was 65 or over. And every day in the US, 10,000 people turn 65, and in 2022, it will be around 3.6 million Americans that will turn to 65 years old.
Wow. So 10,000 people a day are turning 65. Wow, that's a lot. I think the baby boomer generation really contributed to that because, back during the war, before people go to war, they have babies, right? And then they
Yes.
go off to war, right? So then there's a whole influx of generation being born. And when that happened, the need for follow wherever the baby boomer generation went. And now the baby boomer generation is now at the point where they're retired. And so that's why there's so many people jumping, like the numbers jumping up where people are getting older and they need Medicare, right?
Yes.
So can you imagine like 10,000 people a day are going on Medicare? I don't even know if all those people are well educated enough about their Medicare benefits, right? Now, of course, when you become 65 years old and if you're a citizen, you're going to get so much paperwork and you're going to get so many phone calls that you'll be the most famous person in the United States, more famous than the president, because everybody wants to get a piece of you, right? But that's just how it is. Like they have your information, and then they will have insurance companies or whatnot reach out to you to make sure that they give you information about your Medicare, so that way you can take care of everything. But just to let you know, Tom, can you share with us real quickly what are the dates of enrollment for Medicare right now?
Yes, the enrollment period for Medicare would start on October 15 and ends at December 7th. And the Medicare Advantage would be on January 1st to March 31st.
Got it. Okay, so like Tom said, open enrollment is already in process, right? October 15 to December 7th. So you don't have a lot of time, like less than 2 months to, enroll into a plan, disenroll into a plan, change your plans. Now, if you're on a Medicare Part C program, then you have one additional chance to make one change during January to March of 2022, right?
Yes.
So let's get into it. So now that we have a little bit of statistics, the need for Medicare is huge, right? And it's just a growing need time over time. And so that's why we want to do this live stream. We want to share more information about it because there is a big need out there, and we don't know if everybody is getting the answers that they need, but we want to share information as like a friend talking to a friend, so that way we can get that information out to you guys. But let's get into the meat of our live stream now, Tom. So Tom,
Yes.
I think you prepared some questions for us, right?
Yes, I do.
Okay.
And I know that there are 4 parts of Medicare, and can you go over like what are 4 parts of Medicare for us?
Okay. Which one you want to go first?
Let's go with A first.
A. All right, we go in order, right?
Yes.
So Medicare, there is 4 parts to 4 primary parts to Medicare. And so the first part to Medicare that we need to know about is Part A. Okay, Part A is essentially the hospital portion of the budget or insurance. So in order to qualify for Part A, you need to work a total of 40 quarters or 10 years. Otherwise, you have to pay for it, right? And the cost could be anywhere from like $200 to $400 a month if you don't qualify. So you got to make sure that you qualify for that. If you qualify enough quarters, 40 quarters or 10 years, then you don't have to pay for Part A, right? And Part A will cover all of your inpatient costs, inpatient stays, and so that way your hospital portion is covered.
Yes. And can you go over Part B too? B, C, and D.
Okay, so Part B is going to be your medical insurance. So your doctor's office, outpatient, services, when you go to the doctor, you need to have your Part B. So Part B, as long as you're paying, you have to pay, there's a fee for Part B every month that you have to pay, right? So if you have a normal income, you're not low income, then you have to pay, it's about $150 a month right now, but that cost always rising up year after year. So don't think that, oh, you just get into it now and you just pay the same price, then it's just, it's going to rise every year. Okay. But there are ways to waive this, and we'll talk about that later in the live stream. But essentially, your Part B is, your medical insurance to visit your doctor.
Yes.
Okay.
And what about Part C?
Part C is also known as Medicare Advantage. So when you get Part A and Part B, Tom, that's what they call original Medicare. So basically, it just covers you for Part A and Part B, and then you have to go to get your prescription drugs elsewhere. And also, Part A and B doesn't cover you 100%. So that means that, just take for example, maybe the government will only take care of 80%, for example. And that means that you're responsible for the remaining 20%. So how do we cover that 20%, right? So then there's insurance companies that the beneficiary can work with to cover those gaps, right? Yes. And so, they have gaps for like going to the hospital. They have gaps for co-pays and gaps for you going to the doctor, right? So when you have a Medicare Part C, I would usually describe this as like a three-path way that you could take for Medicare when you get to enrolling. But we'll talk that in a little bit. But just to answer your question about Part C is your Medicare Advantage. Basically, the private insurance company are going to coordinate the benefits with the government with Part A and Part B, and they're going to cover everything in between for you. Now, when you're on a Medicare Part C, you could choose between HMO or you can choose between PPO, right? There may be different costs for that. And then you will be restricted in terms of where you can use your insurance, right? So if you get into a Medicare Advantage program, it's most likely going to go by your county or locally where you live. So you're going to have to coordinate your benefits with the local hospitals and the local clinics and doctors.
Yes. And what about Part D of Medicare too, and John?
Okay, so Part D is the last part of it is your prescription drugs, D for drugs, right?
Yes.
So when you get older or when you get sick, you're going to have to be on medication. And so registering for your Part D is extremely important because you need to get your drugs that way, right? And then when you register for that, you may pay a fee for it, or you could waive it if you're low income. But generally, there's a premium that you have to pay for having Part D as well. And you still have to pay for the cost of the medication. So it doesn't mean that you pay for Part D and then everything's free, right? Yes. So you still have to pay some money.
Okay. So to summarize what Anchon said, Part A would cover your hospital expenses, and Part B would cover your medical, and Part C would cover the gap of Part A and B, and Part D would cover for your medication or drugs.
Yes, you got it.
And okay, what are monthly costs for those programs, and how do we pay them?
Okay. So it's a good question. So for your Part A, like I said earlier, if you qualify for 40 quarters, then you don't have to pay. Okay. But Part B, if you are under the like a normal income, you're not low income, then the premium is roughly about $150 a month that you have to pay.
Yes.
Okay. Part D, it depends on your income as well. If you're low income, you may pay a little bit less, or you may they may pay for that portion for you. And then Part C, it depends on what kind of program you choose, but generally what Part C does is that it combines Part A, B, and D all together, and you only have to pay for Part B. Now, if you want extra benefits like PPO, or you want, some companies charge you for like dental benefits or vision benefits, you may pay extra premium for those things, right? But the only other way, that is like the main way. Now, if you're a low income and you qualify for Medicaid or that you qualify for SSI, which is the Supplemental Social Security Income Benefit, then you may qualify to have your Part B premiums waived and you don't have to pay them. But that is determined by your finances. So if you register with the state, or if, say, you're already receiving SSI from Social Security, then likely because you already qualify the low income requirement test to qualify for that program, you're automatically going to qualify for Medicaid, but you just got to let Medicaid know that you're applying, right? So it's kind of like the two pathways you can take. One is that it's just general. You have Medicare, original Medicare with your supplement and your drug, which is path number one. Gives you the most flexibility, but you're going to pay the most premiums. Or you can go path number two, which is you go with Part C or Medicare Advantage, where you still coordinate all three, Part A, B, and D together, but essentially you'll probably only pay for your Part B premiums. If you're low income, you don't pay anything. Or the third way is that if you qualify for Medicaid or you're very, very, very low income, you don't pay anything at all for your premiums.
Yeah, that's good. So what are my options if I have like low income and low assets?
So low income, low assets, generally each state has their own guidelines, but the guideline usually in general is about if you're single, you have $2,000 in your bank account. If you're a couple, $3,000, and you have to have a low income. I would generally suggest that if you are, check your state guidelines, what the income requirement is for Medicaid, and then they should be able to qualify you based on that. But I would say generally if you're above, like below $25,000, $30,000 a year as a couple, then it should be enough to qualify.
Yes. So let's talk about Medicaid. How do I qualify for Medicaid?
So Medicaid, like before, like I said, it's a state program.
Mm-hmm.
So there's two ways you can qualify. You can go first to Social Security, try to apply for SSI. Mm-hmm. Right? If you qualify for that makes it really easy for you to cross-qualify over to Medicaid. Or you can just go straight to your Medicaid state website and then just call them or apply online, depending what you're comfortable with. And you can fill out an application and usually let you know in about a month or so that you qualify or not. They may call you just to do an interview with you, just to verify your income and your assets. But as long as you qualify the income and assets, then you can enroll into the Medicaid.
Okay. And what is Medicare supplement?
So Medicare supplement. Medicare supplement is kind of like a Part C, but it's like the path number one that I told you guys about before. So if you go with path number one, why would you go path number one? Path number one has original Medicare, which consists of Part A and Part B. It has Part D, mm-hmm. and then it has a Medicare supplement, or they call it Medigap. And what that does is that covers all the extra costs that you have to pay that Part A and Part B don't cover.
Yes.
Right? So let's just give the example. The government pays 80%, but then you're responsible for 20%, unlimited amount. Right? So if, say, you have a $100,000 bill, you pay $20,000. What if you go into the hospital again and you have another $100,000 bill? That's another $20,000 you have to pay, and it's unlimited. Right? So yes. when you're retired, you have low income, right? Mm-hmm. So you're on a fixed income. Having two big bills like that, it could be likely happen because you're old, right? Yes. You could get sick. So how do we protect ourselves? That we use Medicare supplement or Medigap so that we can cover for those costs, so that we don't have an unlimited cost that we have to pay, right? So yes. That's what Medigap or Medicare supplement is. Now, you have to pay for that, right? Because you're asking them to cover everything. So yes. in exchange, they will say, okay, well, if that's the case, I'm going to charge you X dollars for this program, right? And let's just say it's like $150 a month, then that you have to pay that. But every year that cost is going to go up because as you get older, the more risk that you have, right? So you're going to want to get into a program. Why do you want to do this program? Because you want flexibility. You want to say that, hey, I want to go to California, visit my family, and I want to use my insurance while I'm staying there because I'm going to be there for 6 months.
Yes.
right? Or I'm going to go travel to Florida now, or New York, or New Jersey, wherever, right? And you want to have ultimate flexibility. Well, going path number one with the Medicare supplement, with your original Medicare and your Part D is going to give you the most flexibility, but it's going to cost you the most, right? Maybe you pay an extra like $300+ a month just on extra premiums. So, do you have that kind of money? Maybe you do, right? We don't know.
Yes. And so basically Medicare supplement or Medigap is like, it's similar to Medicare Part C, but it's gonna cover what Medicare doesn't cover.
Yes.
And yes. And
so Medicare Part C, everybody, to remember easily, just think of it as path number 2, right?
Yes.
So you still have original Medicare Part A and Part B, but what it does is that Part C comes in and coordinates everything, and then now it becomes one program, and they also add in the Part D in there. But why would people choose Part C, right? Part C is they will restrict you to the area that you live in, right? The county, like I said earlier, but then you get a lot of extra benefits.
Yes.
So you get like, some people like the benefit of, hey, I get to go buy over-the-counter drugs at Walmart or CVS or something like that. Yes. Or I get to go to the gym. I get to get vision and dental benefits, right? Because in your supplement, path number 1 doesn't include it, right? And your original Medicare doesn't include it. You have to buy the extra. Yes. So going into Part C, they'll give you those benefits for free. Right? Now they'll give you, depending on the company you choose, they may give you an allowance of how much you can use, but there's a lot of cool extra benefits. So you get all these extra perks, but what is the drawback of Part C or Medicare Advantage is that you have to use it with where you live. So say if you want to go to California, you can still use it only for emergencies, but if you want to get checked up or you want to utilize all your cool benefits, you got to go back home. Right? So you got to think, hey, am I retired? Am I going to travel around a lot, or am I going to stay in one place, right? And then you make the decision to see what you like. But sometimes when you go choose a Medicare Part C program, you're going to be restricted to the network as well, not only as the area. So you got to make sure that your doctor and your medications are covered, right? So you're trading off flexibility for lower costs. And so basically you don't pay a lot monthly. You may pay very little or none, but you only pay when you need to. So even though, like, say in the supplement, they take care of everything for you, right, unlimitedly, well, in the Medicare Advantage or Part C program, you may have an out-of-pocket maximum. So the out-of-pocket maximum means that maybe you are responsible for, just to say, $3,000-$4,000 a whole year, right? So that means that you still have to pay something, but you only pay it when you need it. You're not paying every month, knowing that, hey, I don't know if I want to use it or not. This one, Part C, you just pay when you need it. Okay, so that's the 2 paths.
Yes. And what is Medicare Advantage, and is it better than Medigap?
So like we just mentioned, the Medicare Advantage, it's not to say that one is better than the other, right? It just depends on the situation which you want, right? Like I said, you want flexibility, you go with Medigap, medical supplement, but it's going to cost you more money. If you're going to go with Medicare Advantage, you get more benefits, perks, but you don't have as much flexibility. So I don't think one is better than the other. Now, some agents, they may like push one over the other because maybe they get paid more commission for that. I don't know, right? But to me is that usually I like to lay out the path for the client, and then it's their job to walk down that path, right? And we guide them along that path, but we don't walk the path for them.
Yes.
Our job is just to make sure that, hey, this is what path number 1 is, this is the path number 2, and then there's a obligatory path number 3, which is the Medicaid path. So you have 3 paths that you can go, but which path is your path? Our job is just to educate you, ask you the questions, and then you determine what is best for you, and then we guide you depending on where you need to go, right? And it's because it's finance, right? It's not my money, it's not my health, it's your health, it's your money. So our job here is not to walk the path for you. Our here is supposed to guide you, right?
Yes. Yes. So if I don't enroll on time, is there going to be any penalty?
That's a very good question, Tom. So for someone who is just turning 65 for the first time, congratulations. You've hit retirement. But retirement, not just a number, it just depends on when you're ready, right? But in
Yes.
terms of for the government's eyes, that when you turn 65, you have 3 months to enroll before your birthday or after your birthday. So you have that 6-month window.
Yes.
If you don't apply on time, they will penalize you 1% of the national average each month that you're late. And they'll add that to your total premium for the rest of your life.
Wow.
So say if that premium this year is $150 and you were late, they'll add that percentage into your total premium, and that's a permanent penalty raised for the rest of your life. So you better hope that you got path number 3 that covers your Part B premium, because if you're a normal person and you forgot to enroll for some reason, you're in trouble, right? Because
Yes.
you're going to pay quite a bit. And now also, ladies and gentlemen, the penalty applies on Part D as well. So if you don't apply for your drug coverage because you think, oh, I don't need drugs, I'm happily healthy and I don't believe in drugs, and you don't need it, well, later on when you do need it and you want to enroll into the drug program, every month that you did not apply, they're going to tack that penalty on to your total cost. So the only way you can avoid that is if you're on Medicaid.
Yes.
Yeah.
So please be on time, guys.
Yeah, don't be late. But that's why you're so famous, because they know those penalties. So they have so many people calling you, right, to make sure that you get to enroll on time so you're not late.
Yes. So I have one question about Medicare is how do I qualify for Medicare?
Medicare?
Yes, Medicare.
Okay, so how do you qualify for Medicare? So in order to qualify, now that we know all the good information about Medicare, that's a good question. How do I qualify for this thing, right? So when you turn 65, you will qualify to be on Medicare. You got to be a U.S. citizen,
Yes.
okay? And then you should be working 40 quarters so that you don't have to pay for the Part A, right? So when you get to 65, you're a U.S. citizen. Now, say if you are a green card holder and you are in the process of getting your citizenship, but you've been here for more than 5 years, then you can enroll into Medicare as well if you're over 65 years old, right? But you have to wait 5 years if you're not a U.S. citizen yet. Another way that you can get into Medicare is that if you're disabled. So if you're receiving disability from Social Security, that's a good sign that you should qualify already. Or if you had a disabling condition for quite some time and the doctors have certified it, then you should apply for Medicare, so that you can enroll into that program. Because like I said earlier, you mentioned 63 million people, but about 10 million people are on disability, right? So there are some people that have Medicare due to disability. Okay?
Yes. So how much do I need to pay for Part A and Part B if I have not earned enough credit for 10 years?
Right, so like we mentioned earlier, everybody, the Part A, if you don't qualify, the cost could be anywhere from $200 to $400 a month. It's a lot, right? So
Yes.
try to keep working. Unless you qualify for Medicaid, right, then you don't need to worry about the Part A fee anymore. So there's a couple ways that you can go about it, but you have to look at your situation to see you qualify. Now Part B is driven by your income, okay? So how much money you make, it can start out as low as right now, it's a rising cost every year, but it could be about $150, and it can go up depending on how your income is. So if you're a really high income earner, you're gonna pay more costs on your Medicare Part B premium, right? Mm-hmm. So it could go up to, I've seen it go up to $400 plus for the Part B as well, if you have a high income. Now most people don't fall into that bracket, but there are people that do, right? So if you
Yes.
do, I'm sorry, you're gonna have to pay more for that.
Yeah. And I think that are all questions that I pretty much have for today for you.
Okay.
And do you have any more things to say to the audience?
No, that's pretty much it. I mean, I want to go into another live stream later. We talk more in detail about Medicare Supplement versus Medicare Advantage. But today, the main thing about today is just to give us the basic grounds for what Medicare is. Now, Tom, there is something that I want to share with you guys, since you did ask if there's anything else, is that a lot of people, when you get to the point of like over 65 years old, there's this big thing that, you know, a lot of times when people get sick and they're older, like they have a fall or they can't take care of themselves and they need to go into a nursing home or they need to have somebody come take care of them, right?
Yes.
And so Medicare, there's a misconception that Medicare pays for all those costs, but it's not true. Medicare does not cover all those costs. It only covers for the first 100 days of those coverages for you to go into a nursing home, for you to go into hospice care, for you to go to rehab, or maybe you have a nurse come to your house to take care of you. Just like my grandma recently, she had a really bad fall and she broke her hip, and now she can't do anything for herself anymore. She has to, my family has to carry her, has to dress her, bathe her, let her go to the restroom, feed her, do everything for her, right? Wow. She can't do anything by herself anymore. And it's unfortunate, but you know, my family has to take care of her, right? Because we love our mom, our grandma, we got to take care of them. But sometimes like the family needs some expertise help because there's some things that may be medical related that the family may not know. So then if you need a nurse to come and help give professional care to grandma, that is only covered a part from Medicare. And then afterwards, you have to pay that out of your own pocket. Wow. And if you pay it out of your own pocket, where are you going to get the money to pay that? And that's where long-term care is extremely, extremely important, is that if you're already 65 and up, it's probably going to be really hard for you to qualify for long-term care. But say if you're those children that are taking care of your parents right now and you see how hard it is, you got to start preparing for yourself now, right? Yes. 50s, late 40s and the 50 years old is the best time to start preparing for your long-term care needs, because you know it's going to happen to you someday, right? Yes. I mean, we all get old and we're all going to get to the point where we can't take care of ourselves. Who's going to take care of us, right?
Yes.
And so sometimes, like, you know, in a busy world now, a lot of times, you know, it's not, a lot of families before have big family, right? Has like 6 children, 7 children. You got a lot of children to take care of. I don't have to worry, right? But nowadays, families are smaller, right?
That's right.
In your family, how many siblings do you have?
I only have one little brother.
One little brother. So you're the older brother, and you got a younger brother.
Yes.
Right? So if later on when your parents are old, who's going to take care of your parents? Between the two of you, right? What if you're both working?
Yes.
Right? So who's going to take care of the other person? Unless you have enough money to pay for your brother to take care of mom and dad, right? Or reverse back, your brother makes enough money for you to stay home, take care of mom and dad. Who's going to take care of them? Well, then most likely a professional has to do it. And where does that? Professionals don't work for free, right?
That's right.
You gotta get paid, right? So as the generations get later on, they don't have as many children in the family like our grandparents' generation do, and so the main time is the family mostly have to stay home to take care. But most people are working nowadays, and it's really hard to coordinate that. And we have to keep taking off work, and there's so much time that you can only take off before work doesn't like that you're off so much. Right? So if you can plan ahead for your long-term care, it's extremely important. It's a separate cost from your Medicare. Don't wait until you're on Medicare already, because likely it's going to be too late. Now, if you're on Medicaid, then Medicaid will help take care of your long-term care costs, but under their stipulations, under their network, under their facilities, right? You don't have the freedom of choosing what you want. When you prepare your own long-term care, you get to choose what you want. Right? Yes. And the earlier you plan, maybe you put in $1 now, later on in life when you do need it, maybe you get $3 to $5 of benefit. So try to leverage up what you're using now so that you don't lose your money later for paying off for all those costs, or your family doesn't have to come out of pocket for all those costs later on, because, you know, asking someone to take money out of their savings or take it from their income is tough, right? Because sometimes everybody has their own family, their own costs, and now we have to come up with extra cost. Is hard, right? So if you prepare ahead of time, it lowers the impact financially for you guys. So we will talk more about long-term care as well. I love the topic of long-term care. A lot of people who hear me talk about long-term care, they know they need it, but some people, unfortunately, it's too late, right? But it doesn't mean that it doesn't hurt to try to see if it's within budget for you, but it's always best to start as early as you can.
Yes.
Okay. So do you have any other questions for me, Tom, about Medicare that you're curious about, you're not sure about?
I think that would be all for today, yes.
Okay,
I
very
think
good.
I've been asking a lot of questions already.
Hey, so we got to ask a lot of questions. That's how we learn, right, Tom?
Yes.
So that's why, Tom, thank you, Tom. I know this. You're still learning to do all this, and I know it's nervous when you have all the lights shining on you, and you have your video camera in your face.
Feels
I mean,
like
the
a
camera's not
superstar.
that far, but I think you're getting there, right?
Yes.
So keep asking questions, keep learning. Those in the audience, if you have any questions, please send us a message or call the office. We're always ready here to help you with any part of your finances. In particular, right now we're talking about Medicare, but Medicare season is here. Just a reminder, it goes from October 15th to December 7th, and then afterwards, if you're on Medicare Part C or Medicare Advantage, you have one opportunity to change one more time between January and March. Other people that qualify for special enrollment, say for example you're working at a company right now, but you quite haven't retired yet, then you're allowed to stay on your work plan as long as it's a qualified plan until you fully retire or you decide to stop taking that. Even if you continue working, you can bear the benefits to see which is better. But once you stop that, you have a timeline that you can enroll into the Medicare afterward without being penalized, right? So make sure that you make do with those dates, get that down. If you have any questions, please let us know. But again, make sure you follow our page, like us, and on our YouTube and Facebook. It really helps us a lot. And that's pretty much for today. So this is the Paramic Hour with Jonathan and
Tom.
Right, Tom, thank you very much. And we'll see you guys later this Thursday. Thank you. Bye-bye.
Bye guys. Peace out.